Hello there. We're here to talk with Robert Fraser, the founder of the CCSVI Hope Ambassador Society, a not-for-profit organization based out of British Columbia to help fund the treatment for MS patients. Hello, Rob.
Hi there.
I have a few questions for you.
Fire away.
Would you mind telling us a little bit about your disease history, your medical history?
Well, I had problems since actually about 2005 with my balance. Wasn't really serious, but on my last vacation in the Ukraine, I was falling a lot and having a hard time keeping up. So I checked with my doctor when I returned to Canada, and after a CAT scan, he said, well, you might have MS. That's what it shows. So he scheduled me for a talk with a neurologist and an MRI. Both of those frequently took 6 months, but they found that my diagnosis came back as having primary progressive multiple sclerosis, which is about the second worst kind there is. That was confirmed with a spinal puncture.
And what was the exact date of your diagnosis?
The official diagnosis came in May. I don't remember exactly which day, but in 2009. That's when the official diagnosis came.
And how they found out that you have multiple sclerosis? Is it a common method, or are there other ways to diagnose this?
Well, the most common way is actually through the diagnostic testing from a neurologist, covering everything from your balance to memory to cognitive ability, and right down to being confirmed at times with a spinal puncture when they actually withdraw about 3 test tubes of spinal fluid and analyze that.
And how did your confirmed diagnosis make you feel at that point?
Lousy. One of the reasons that it's so bad is that from the time of when it was originally spotted as a probable with that CAT scan in December 2008 to the official diagnosis in May 2009, that left about 6 months of wondering why, oh, I've got MS. And it's a whole new aspect that opens up to the patient about, well, what exactly is MS? Because that's so unspoken of. And I find out that there was various types. You know, you always had this vision of the person in a wheelchair with MS, either that or crutches. And that's not always the case. That's not always the case. So, but that's really not a thing to look forward to. And it's with no other options available, it really sort of takes its task on you.
I would imagine you felt an enormous sense of loss.
Well, the loss came with the fact that I used to be a pilot. After my diagnosis, I can't be a pilot anymore, obviously. I was had just a year prior to my diagnosis, I become licensed in 2 provinces as an emergency medical responder, and which is just just prior to going into my training as a paramedic, and that was lost. That was gone. I was also an equipment instructor, or lift equipment instructor, and that was gone as well once my diagnosis came through. With that, I was a manager at the time as well, and my cognitive abilities, memory, and vision impairments took place during that time, and I was basically opted out of that position. So I basically lost everything.
Well, I'd like to thank you for speaking with us, and we'd like to thank you for watching. Be sure to visit our website, the CCSVI Hope Ambassador Society. Be sure to contact us if you have any questions, and take care of yourself. Thank you. Yay.